Good day. I am Afea Rogelat Alvarez from BSN 12H, and now I'm going to perform the adult cardiopulmonary resuscitation and AED skills. First, I'm going to begin with the assessment and activation. So I arrive on a scene and I see that the patient is unconscious or appears to be unconscious. The first thing that I'm going to do is to scan the area, check the environment for any hazard present. A hazard could be a fire, falling debris, chemicals, or just anything that could potentially harm us, because if there is a hazard present and if we do get injured, we will therefore be unable to help and assist the patients now. After ensuring the scene is safe, I am going to check the level of victim's consciousness and responsiveness by tapping the patient's shoulder and asking if he is okay. Sir, are you okay, sir? Sir, are you okay? Check for responsiveness by tapping both shoulder and call out names on both ears. If no response, call for help and activate emergency response system. Hey, please call 911. There's an emergency here. Opens airway and check the breathing and circulation for up to 10 seconds. So if the patient is wearing constrictive clothing, we'll have to loosen it up, and we'll have to check the patient's mouth as well to see if there are anything that is in there and that cause any obstruction of the airway. Example like dentures. If no signs of circulation, proceed to cardiopulmonary resuscitation. To do that, perform hand placement on a lower half of sternum, adequate rate at 100 to 120 per minute. Deliver each set of 30 compression in 15 to 18 seconds and compress at least 2 inches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 30. Complete recalls after compression, and avoid excessive ventilation and provide 2 ventilations after 1 cycle of 30 compression. And after 5 cycles or 2 minutes of CPR, reassess the patients by checking pulse and breathing in not more than 10 seconds. Next is Powers AED, and correctly attaches the pad. Next is clear for analysis and clear to safely deliver a shock.
Clear.
Clear!
Ay, gunitin. Clear.
Pag-bislit niya, igunit na mamatay siya kakapit.
Clear.
Abuhay siya kapiloy.
Clear, clear.
1, 2, 3. Clear! And safely deliver a shock. Switches roll every 2 minutes or after every 5 cycles. Practice good team dynamics and reassess the patients after 2 minutes. If return of spontaneous circulation is not achieved, repeat the procedure. Once return of spontaneous circulation is achieved, place the patient in a recovery position and documents the time the procedure. So now, the next thing I'm going to do is to perform the child and pediatric cardiopulmonary resuscitation. This involves a child who needs immediate resuscitation. The step on doing this procedure is just the same with the adult CPR. The only difference is the number of fingers used in the chest compressions. To begin with, we'll have to check the environment and make sure that the scene is safe. Next, check the responsiveness of the patients by tapping both shoulder and call out name on both ears. If the patient is not responding, call for help and activate the emergency response. Baby, baby, are you okay? Baby, baby, are you okay? Sir, please call 911. There's an emergency here. Open airway and check for breathing and circulation for up to 10 seconds. If no sign of circulation, proceed to cardiopulmonary resuscitation. One, two, three, four, five, six, seven, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 2, 3, 4, 5, 6, 7, 8, 9, 10. Avoid excessive ventilation and provide 2 ventilations after 1 cycle of 30 chest compression. Continue the CPR with a 30 to 2 compressions ventilation ratio. After the 5 cycles of 2 minutes of CPR, reassess the patient by checking pulse and breathing in not more than 10 seconds. And if return of spontaneous circulation is not achieved, repeat the procedure. Once the spontaneous return, place the patient in a recovery position and document the time the procedure started, and that's all. So for the last CPR is the ay baba na.
Siya, walang libog siya. Asa
Ay,
na
kato
yun,
infant, ingon pa man yung infant, tas ibaba na ko.
I'm going to perform a newborn cardiopulmonary resuscitation. The first thing we need to do is to check the UPGAR score of the baby. The UPGAR score is a test given to a newborn soon after birth. It is a quick test done at 1 minute to 5 minutes to tell us how well the baby birthing process outside the mother's womb. For this return demo, let's assume that the baby's UPGAR score is 3, which we know fall within the concerning range. That means this baby needs an immediate cardiopulmonary resuscitation. After knowing the baby's UPGAR score, check the responsiveness of the baby by rubbing the sole of the feet or rubbing the back of the baby and calling the baby out loud. Baby, baby, baby! Baby, baby, baby! And if there is no response, position the baby on his back and call for help. We have to call out Cold Blue or Dr. Squeak so that the nurse and doctors could come over and help to revive the baby. What we have to do next is to open the baby's airway and suction if necessary. To suction the baby's mouth and nose, we use the suction bulb. We'll have to remove the secretion if there is any that's blocking the baby's airway, and after that we'll also do the head, tail, chin, and lift to still open the baby's airway, and if the baby is still not responding to the stimulus we did, we'll have to perform the PPV or the position pressure ventilation. So there are 2 types of PPV. It could be an invasive through the use of ventilator or the non-invasive one through the use of pediatric bag valve mask. Now this time, I'm going to use a bag valve mask to cover the baby's mouth and nose with it. Hand position to cover the baby's mouth and nose with it. Hand position would be the thumb and forefinger to the hand and will be the place at the rim of bag mask to ensure the pressure seal. The remaining finger in the jawline of the baby. This is done to the other hand is the leading of the baby's eyes, not compressing the baby's neck and support the baby's head. so that will help to delivering the oxygen to the baby. Provide the proper ventilation, so that we are going to do is to breathe 1 to 3 seconds to 40 to 60 minutes per hour. 1, 2, 3, 1, 2, 3, 1, 2, 3. After doing that, someone will be attaching a heart monitor and pulse oximeter to the baby to determine the baby's heart rhythm and measure the hemoglobin oxygen saturation. This will help us to monitor the effectiveness of the CPR. If there is no increase of heart rate after performing the PPV, we'll have to proceed and perform chest compression and rescue breaths. So what we're going to do is 2 to 3 fingers to locate the lower half of the breastbone of the baby and start the compression, and we also do the 2-thumb technique wherein going to encircle the baby's body using our hand and circle the thoracic area and the baby, and let the 2-thumb rest at the center of the baby's chest and start the compression. But now I'm going to do the 2 to 3 fingers technique. So I'm going to do the 30 chest compression to rescue the baby's breath, and would be a depth of 1 inch only, since the baby's bone isn't strong enough to handle the immense pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now be giving the baby's chest compression and give 2 rescue breath and repeat chest compression. And now we'll have to do that for at least 4 cycles, and it's still no increase of heart rate. We'll have to continue doing the CPR and prepare to assist in the incubation. Incubation, where a doctor inserts a choke through the baby's mouth and nose down to the trachea and keeps the trachea open and allows air to pass through. If the baby has an increase of heart rate after the compression and the rescue breathing, we can now proceed to post-resuscitative care, where we could refer the posterior care of algorithm, because we could find them the procedure and tests that need to be done to ensure that the baby is doing fine. The 2 post-resuscitative care that I know is through monitoring administered oxygen concentration and the arterial oxygen saturation. So after doing the procedure, we have to document the process, and we'll have to input the time started and ended, and also the response of the baby to the medication and treatment. So that would be all. Thank you.